The importance of health and well-being to the development of a society cannot be overemphasized. In Kwara State, the administration of Governor Abdul Fattah Ahmed has consequently placed a strong health system at the core of its strategy for developing human capital and transforming lives. The Kwara State government, under the leadership of His Excellency Governor Abdul Fattah Ahmed, has therefore made the health sector one of its key areas of focus, with laudable initiatives such as the expanded Community Health Insurance Scheme (CHIS), primary health care development, as well as the remodeling and equipping of 5 major general hospitals across the state.
Since commissioning of the hospital, we have been, delivering as per mandate. We initially started with our foundation staff, and we have grown. We have also commenced services in so many areas of healthcare. Initially, we started with general outpatient services. We started with pediatric services, obstetrics and gynecology, internal medicine, general surgery. We also started services in area of pharmacy, radio imaging, laboratory services, dental services. That was when we commissioned. And since then we have grown. We have expanded in our area of services. We have started ENT, ear, nose and throat services. We have started eye services. Okay, we have also started orthopedic services. And we're still expanding. From the time when we commissioned this hospital on the 10th of June, our patronage has steadily increased to the extent that if you go to our general outpatient department, it's like a marketplace. If you go to our antenatal clinic, it's like a marketplace. Our clientele has grown steadily, to a level wherein we attend to between 7,000 and 10,000 patients, every month. Some of these patients are new patients. Some of them are repeat patients who have come for follow-up. So our clientele has been increasing steadily.
The health sector, it borders on 2 key areas. Firstly, improving availability. Secondly, improving accessibility. Availability will be improved by, of course, looking at the current levels of the primary, the basic health centers, the general hospitals, and of course the specialist hospitals. We've done quite a few, just like you said. We did 5 general hospitals. We also look at new areas where we need to improve the general hospitals. We go ahead, do the improvement. And then we look at new areas where general hospitals are required as a result of increased population. We build general hospitals there. We look at areas where primary health centers are required, and ditto basic health centers. The most important thing is that we'll still be pursuing our policy of ensuring that people do not move more than half a kilometer to access basic health services. That is in terms of availability.
The successes recorded by the Kwara State government in healthcare delivery led the National Health Insurance Scheme, NHIS, to partner with the state government to further achieve its health sector goals, as affirmed by the Executive Secretary, National Health Insurance Scheme, Mr. Femi Akingbade.
I would like to commend the state government on the initiatives that they've started so far. I normally tell my people, I said, in all the states in Nigeria, Kwara State happens to have the most structured health insurance in the whole of the country. This is a plus for Kwara State because a lot of states actually preach free health, which I normally say that healthcare can never be free. And if you actually come to Kwara State, even the beginning was very structured. Kwara State is the only state that I've seen that even before they started their health insurance, they did a baseline survey, and all the achievements so far are measurable. And that is a plus for Kwara State.
Among the 5 general hospitals renovated and furnished with modern equipment is ILORIN General Hospital, standing as the crown jewel of the administration's achievement in the health sector. Since its official commissioning in June 2014, the 500-bed capacity ILORIN General Hospital has continued to live up to its objectives, providing world-class healthcare and medical services to people in Kwara State and its environs.
General Hospital ILORIN is really doing very well in meeting this particular need. Because of the location, is in the heart of the city, and people have easy access to this place. Then when it comes to cost, it's very effective. You don't have to pay much to see a doctor, and drugs in the pharmacy, I know it's also very reasonably okay, so it's very effective. In this department, the general patient department, we see close to 200 patients in a day, so the patronage is really high.
Since the commencement of this hospital, the turnout, especially in this specialist clinic, has been improving. Averagely, we are seeing about 20 to 25 new cases per each clinic day, with about 30 to 40 follow-up. Presently, like this ENT consult, even some center does not even have it, that they are even a teaching hospital, though we have just only this one, and it has been of helpful to make our job more easier.
But kini yung shemi money ora ka doctor ni oni mo ko pe ke to shemi bo de kin gbe lo ani ke lo si general hospital ti state ibe ni mo ti le ri tọ́jú kíákíá àgbà tẹ́bi yìí o wọ́n tọ́jú mi dáadáa wọ́n dẹ̀ ní instrument tí ó péye torí mi ò lè sọ̀rọ̀ tí mo débi bẹ̀tẹ̀ lọ́n ti ní gbogbo nǹkan ti wà normal. A lè fi private wé government náà, so a sì lè fi tọ́jú bẹ́ẹ̀ náà wé sọ pé private yìí àwọn ó ṣe gbogbo iṣẹ́ gbogbo ẹ̀ náà wọlé ẹ̀ka ní ọmọ sí bẹ̀tẹ̀ bí kálukú ní department tí ó ṣe bí tí kakú bá mà ní ó dùn sí ó fi jẹ́ pé sẹ́yìn ó sì ṣe ẹ̀tígẹ́tì àdẹ̀lẹ̀ fi náwó bẹ̀ náà gbéra wọn ìnáwó bíi sókí ju bíi ìdíwó ju private lọ.
a gbé mi wá yẹn láṣù ojú ni inú mi dẹ̀ dùn fún àwọn arábìnrin náà tí wọ́n jẹ́ dókítà yá ẹ̀ mo máa ń ṣàdúrà fún wọn tí wọ́n bá tọ́jú mi ká tí wọ́n bá lọ lè mi máa ń mú wọn ládùúgbà gidi wọ́n ṣẹ̀ṣẹ̀ wá ṣe operation ojú ọ̀ ẹsẹ̀ báyìí mo dúpẹ́ lọ́dọ̀ Ọlọ́run mo tún dúpẹ́ lọ́dọ̀ Ọlọ́run mo tún dúpẹ́ lọ́dọ̀ Ọlọ́run so gẹ́gẹ́ bí a ṣe wí báwọn ṣáàyè Ọlọ́run bá ní káwọn sọ sí ìdí pásí sọ sí ìdí yẹn padà.
The hospital boasts of quality, state-of-the-art medical facilities and top-notch expertise of medical and supporting personnel. The General Hospital ILORIN serves as the hallmark of healthcare service delivery in Kwara State. It accepts referrals from all 43 state-owned and 400 local government-established primary healthcare centers and from hospitals outside the state.
Mo ti gbọ́ ròyìn pé wọ́n ń ṣiṣẹ́ dáadáa ń bínú fún wa fún ojú ọ̀rẹ́ mi kan wá bí àjọ ń gbé Èkó ni mo ti wá bí ó náà tí ì tí ó ń bí pé ó dà mo fi wá bí. ẹ mọ̀ pé nǹkan tí ìgbà tójú máa bẹ̀rẹ̀ kò bẹ̀rẹ̀ lọ́jọ́ kan náà díẹ̀díẹ̀ náà mo rò pé ìwòsàn kò lè tán kò lè bẹ̀rẹ̀ kò parí lọ́jọ́ kan àmọ́ ìyàtọ̀ sì ń bá ojú.
mọ́tò accident ló gbé mi dé ibà wọ́n tọ́jú mi níwájú ọlọ́ba àti wọ́n ti gbìyànjú torí àti Onitsha ni accident ti ṣẹlẹ̀ kó tó di pé wọ́n gbé mi wá síbí báyìí láti ìgbà tí wọ́n dẹ̀ ti gbé mi wá síbí báyìí wọ́n try gbogbo àwọn nọ́ọ̀sì tó wà níbí báyìí gbogbo wọn náà gbìyànjú àwọn dókítà tó wà níbí báyìí gbogbo wọn náà try ìdí tí wọ́n fi gbé mi wá ni pé mo máa rí ìtọ́jú tó péye because hospital tí wọ́n gbé mi lọ Ọlọ́run ló yọ mí tó ní ká gbé mi wá síbí báyìí because nǹkan táwọn sọ ìkọlà máa sọ lájọ́ tán ti gbé mi dé ibà mo dúpẹ́ lọ́dọ̀ Ọlọ́run mo tún dúpẹ́ sí ni kò ṣe pé bóyá mo rí fà sẹ́yìn mo tún rí lọ síwájú sí ni.
Yes, some people come all the way from Lagos because they say in Lagos you have to wait, but here immediately you get your services done and you're happy.
The General Hospital ILORIN meets a diverse range of patients' needs through its clinical units. The records section of the hospital is the patient's first point of contact with the hospital. In order to ensure that international standards are met in record time, the management of the hospital set up the triage unit, where patients are first attended to and sorted out according to their medical needs, and then directed to the appropriate clinic or doctor.
This is the triage department or unit of the hospital. What we do here is sorting out of patients because of the increased number of patients. So this unit is created by the management in order to cut short the stay of the patient and to reduce the flow instead of moving from one department to the other. So what we do, we sort these patients out in 3 categories. We have the emergent cases, the emergency, and those that are not non-emergency. The emergent are those ones that are very serious, they go straight. For the emergency, we refer them to the emergency units. And for those that are non-emergency, we refer them to general outpatient department where they see the doctors.
At the general outdoor patient department, patients are attended to by doctors on duty. The rate of patronage at the general outdoor patient department has been on a steady rise since inception, and this is as a result of referrals from clearly delighted patients.
It was a good idea for the state government to renovate this place. Very good idea, because by the time the teaching hospital left this place, this is like the center of the town. Everybody has been used to this place, and then moving down so far away from the town, it was a big distressing for patients to access health care there. So I was not surprised when shortly after this place was renovated and it was announced that we had started work here, the kind of turnout that we saw. I mean, it was massive, and it has remained like that. In fact, there is increasing on a daily basis, quite massive.
Àwọn nurse doctor wọ́n tọ́jú mi dáadáa tó yẹ pé ìyàtọ̀ ti bá mi sìn ibi ìbá ti gbé fún dò pé mi tí ì ṣe nǹkan tí mo fẹ́ ṣe bọ̀tì èmi náà mọ̀ yìí pé mo ti yàtọ̀ sí tìgbà tí mo kọ́kọ́ dé wọn ò dẹ̀ ń kanra mọ́yàn.
Whenever there is patient, either they rush the patient come here, both nurses and doctor they be running helter-skelter to save the life of that patient. They don't say this is Yoruba, this is Igbo, this is this thing. All of them, they are working hand in hand.
At the accident and emergency unit of the hospital, doctors and nurses attend to very critical cases that are brought in and need urgent attention and close monitoring.
Mọ́tò ló gbá mi lórí ọ̀kadà ní ṣáìdì ilé wọlé dé. Ọ̀nà fi wá bá ṣe wá tẹ́lẹ̀ ojú táyọ̀ náà gbé mi lọ. Àwọn òtúbí táyọ̀ wá láwọn lè gbà mí pé àwọn rí pé wọ́n try ní General Hospital ní Táíwò tí gómìnà wa Abdulfatai tó dá kalẹ̀ pé àwọn rí pé gbìyànjú wà níbẹ̀ pé kí n lọ sí ibẹ̀ náà fi gbé mi wá sí ibẹ̀. Ìgbà tí mo débí báyìí mo rí pé ìtọ́jú wọn péye torí alihamdulilayi Ọlọ́run tẹ́lẹ̀ fún mi ó kàn fún mi bí báyìí. Àmọ́ bí mo ṣe dé mo ṣe bẹ̀rù ọwọ́ kan ni doctor attend sí mi torí pé kí ni mo ti lose ẹ̀jẹ̀ púpọ̀ jù. Àmọ́ ṣe gbà mí tọwọ́ tẹsẹ̀ wọ́n sáré bá mi wá gbogbo nǹkan á attend sí mi. Láti gbà tí mo sì ti débí báyìí àwọn nurses bẹ̀ on try.
The maternity ward of the hospital successfully takes deliveries of hundreds of babies on a monthly basis since it opened to the public. The labor rooms are fitted with modern technology, making it a far more preferred hospital in the state for expectant mothers to take delivery of their babies.
The environment is okay. The nurses are okay. When I came yesterday evening, they attended to her very well. Very, very well. All of them were running around. and the labor was very easy and they are okay, in short, very okay, and God is helping them. The office is also okay compared to private, because I've been in private for my firstborn, and with the charges and treatments, I can say to me everything is okay.
This mo fi wá sí báyìí ni pé mo fi wá láti bímọ sí báyìí ní pé gbogbo nǹkan wọn lọ létòlétò, gba àwọn clinic wọn ṣe dáadáa ńbẹ̀. Bẹ́ẹ̀ dẹ̀ nígbà tí mo wá bímọ náà kan wọn dé kò dàbí private tí gbogbo ẹgbẹ́ olórí gbogbo ṣe létòlétò. Wọ́n dẹ̀ lọ dídí.
Special care baby unit of the maternity ward can compete with what is obtainable anywhere else in the world with life-saving equipment and facilities. There are also specialist clinics such as the ophthalmic clinic and a dental clinic. In addition, the ILORIN General Hospital boasts of a twin theatre fitted with state-of-the-art equipment such as autoclave machines, anesthetic machines, oxygen concentrator, electric suction apparatus, sphygmomanometer, Murden weighing scale, ultrasound machine, infant ventilator, and incubators with the goal of delivering world-class services. Also available is a world-class laboratory furnished with modern equipment such as colony counter, automatic electric hemoglobin meter, hot air oven, water jacket incubator, special blood bank, and giant autoclave machine. The radiology section is as well equipped with digital X-ray, mobile unit, and ultrasound machines with modern technology that allow patients get their scan results immediately.
We have services that we render to patients. We have the diagnostic X-ray machines and we have the ultrasound machines. And these are diagnostic tools to help in patient care and management. And I would say that they are now the modernized kind of machines that we have as compared to the old X-ray machines that used to be in place. We have the digitized X-ray machine now that immediately you take your image, it is formed, and then the patient goes with his or her film immediately. Not like the old film that used to be processed and then you ask the patient to come back. So if a patient comes to X-ray department, within 2 hours, the result is supposed to be out, both the image and the report. And that has been in place since the hospital was officially opened last year.
As patronage increases, the hospital management has continued to expand its areas of services, employing more staff and providing more clinics, as well as improving its operational mode.
There was a recruitment, of specialized categories of staff. Medical staff that were hitherto non-existent, within the Kwara State health system were brought on stream. For example, a consultant ophthalmologist was engaged. For example, ear, nose and throat specialists were engaged, anesthesiologists were engaged, and also other categories of specialized specialists were also engaged to offer quality health care. So you can agree with me, that will only broaden the spectrum of services, not just in terms of the quantity, but in terms of even the quality of services, that is being offered. And it's going to get better once we bring some additional services on stream. For example, we have some services that we're planning to come on stream. We have some partners. There are some Nigerians who are Kwarans, who are specialists in spine and neurosurgery, and we have dedicated a section of the hospital when we're going to bring on board spinal and neurosurgery. Spinal and neurosurgery is one new area of services in the country, and is one major reason for which a lot of Nigerians go outside the country, for specialized care. We are hoping to bring that on stream. The proposal is on the table, is being looked at by the state government, and indeed the human resource from the US, they've come around to look at the place, and we're just waiting for them to bring that service on stream.
One unique quality that stands the General Hospital ILORIN out is its exceptional service delivery, offered at a very affordable rate. Here, patients receive good medical services from well-qualified medical experts who provide quality services and facilities that are enjoyed anywhere else in the country and on the continent.
A dúpẹ́ lọ́wọ́ ìjọba Kwara State fún ti General Hospital yìí pé wọ́n ṣàṣeyọrí. Ọlọ́run á máa ràn wọ́n lọ́wọ́ o, Ọlọ́run máa gbé wọn lọ́wọ́ sókè, wọn ò ní ṣìṣe o.
Bí ó ṣe wà yìí, ìjọba tíráyì a sì dúpẹ́ púpọ̀ fún wa, èrè mẹ̀kúnnù náà ó sì gbé wọn, torí pé àwọn tí wọ́n ṣe àtúnṣe gbogbo orí àyè báyìí tí wọ́n sì kó àwọn òṣìṣẹ́ dàbí torí àwa mẹ̀kúnnù náà ni wọ́n fi ṣe, so à ń ṣe ń gbádùn bẹ́ẹ̀ náà, Ọlọ́run máa ṣe wa láláàárẹ̀.
Mọ́tàlẹ́ wọn àtẹ́ǹdì wa dáadáa, àdẹ̀rí torí àdẹ̀rí ìgbìyànjú ìjọba kò dàbí ti jọ̀hún nísìnyí, ìjọba dúró tì wá, àdẹ̀dúpẹ́ lọ́wọ́ ìjọba fún àdúró tì tàn ṣe fún wa.
I don't know the way I put it, it's 98% try. He try.
In fact, ìgbà tá a fi gbé wọn wá, a dúpẹ́ lọ́dọ̀ Ọlọ́run pé àti rí yàtọ̀, torí nígbà tá a gbé wọn dé, àwa náà mọ̀ pé wọn ní di òkú la gbé wọn wá. Tọ́ Ọlọ́run sọ wá dùn fún wọn lálàáfíà nísìn. A dúpẹ́ pé àní gbé wọn lọlé ní òkú, tó a rí yàtọ̀, tá a rí pé àti rí yàtọ̀ gidigidi gan. Tó yẹ pé nígbà tá a fi gbé wọn dé bí ọ̀sẹ̀ kan lẹ wá sísìn ni ẹ̀yin gangan ẹni lè dúró, bẹ̀tà wá dúpẹ́ pé so ẹ̀yin náà lè dúró tí wà nísìn nígbà tí àlàáfíà ti dára.
This is indeed a testament to the people-friendly administration of Governor Abdul Fattah Ahmed. Kwara State, it's good here.